So for the sake of the demo, we're going to skip the first couple of parts regarding the workflow and getting the patient to when they're prepared for the consult. We're going to focus on the live telemedicine encounter. Here we are approaching it from I'm playing the role of both the patient and the nurse, and you're viewing it from the side of the doctor. As you can see, when you log in, you want to be able to have an understanding of where the patient is and why they're in the clinic today. So at first glance, you can see some vital signs. You can see the patient ID in the top right-hand corner. And now, to make best use of the doctor's time, the nurse has taken these vitals before you've entered the consult. They've also included some documents that'll give you an understanding of why the patient's here. So there's a general patient form, maybe a patient consent form, also an ECG that may have been taken upon the patient's last visit to the clinic. From here, the nurse is now at the direction of the doctor. They're an extension of the doctor, so if they want to hear some heart and lung sounds from the stethoscope, they can see where the chest piece is located from the video conferencing on the right, and they should be able to hear very clearly the heart and lung sounds through a pair of over-the-ear headphones. Over-the-ear headphones are recommended so that you can block out a lot of the background noise in a hospital or a clinic. Doctor also has the ability to change the audio filters from their own side. So changing from bell to diaphragm or making the sound louder, adjusting the volume settings. This is critical as the nurse or the attendant is holding the chest piece in one hand, directing the patient with the other. The doctor has the ability to act as the nurse's third hand. Also, within a telemedicine clinical encounter, you should have the ability to take a closer view of the patient using other diagnostic tools, such as a general examination camera. If the patient comes into the clinic complaining of discomfort in their eye or a rash, the nurse, at the direction of the doctor, can give the doctor a really close-up, high-quality view of the eye. Just as would be the case in any hospital environment, the doctor will also probably want to take a look inside the patient's ear. So by changing the medical video source, the doctor can do just that, while simultaneously being able to capture images during the live video and being able to save those into the patient's record at the end of the consult. So any images that are taken, any documents that are provided, whether it be an ECG or an X-ray or vital signs, or perhaps an electronic prescription, the doctor, as well as the nurse, has the power to save that data back to the patient's record at the end of the consult. So at the end of the consult, the data is saved. It's time for the next patient to come into the clinic, and the doctor here would simply clear the session, and the data is erased, so there is no fear of duplicate entry or mixing up the data collected, and the next patient can come into the to the clinic.